How's it going, YouTube? My name is Ian, and this is a start of a documentation of basically my lower back, my lumbar fusion of the L5 and S1. So um, I don't know about you, but if you are thinking about or have had a lower lumbar, spinal fusion, you've probably watched a lot of videos on YouTube, maybe just like this, and looking for maybe additional guidance, what to expect, hopefully some success stories, things to give you courage, hope, whatever it may be. I know it certainly helped me, and hopefully some things that I can share within my first 2 weeks here will also help anybody else watching. So basically, just a real quick recap. I've been very physically active my entire life, playing just about every sport you can think of: football, hockey, basketball, track, baseball, intramural sports. I was really into weightlifting for many years, which actually caused the injury to begin with. I do a ton of hiking, and very active with my family and my kids. But it was bent over rows probably about 13 years ago, just doing too much weight like this, where I think I just completely blew out my lower back essentially. It hurt for about a week, and then like a lot of injuries, when you're younger and in really good shape, your body recovers, and it would flare up a couple times a year, where it kind of knocked me down for a day, maybe two. But I always thought it was probably more of like a torn muscle that I just never let properly heal. Being a typical guy in a way, didn't go to a doctor and have it looked at, and I probably would have noticed that I probably did some damage. So over time, almost like sandpaper, the L5 was loose, and it kind of just slowly kind of wore away at the disc, and the degenerative disc disease set in. And about 10 months ago, just bending over to pick up my son's socks, right? It's something as mundane and simple as that. My back went out, and it hasn't been the same ever since. So I've done probably what many of you have done or are in the process of doing. I've had multiple cortisone injections. Those did give me a relief, but again, it was never going to solve the underlying issue. Medial nerve branch blocks, ablations, physical therapy. But after a while, it just got to the point to where, no matter how much training I would do properly or eating right, it was never going to solve the issue. So finally, I just decided to work with one of my doctors, get in touch with a really great surgeon here in Washington State, and make the leap essentially, and go for lower lumbar fusion. So as I alluded to, I don't want this to go like a super long video, but I wanted to give a little backstory, especially for someone, again, like myself, who has been always physically active. I know in the video I'm looking at myself, and I definitely have lost a lot of upper body size and strength, but for someone like that, especially the last 6 years of really just being big into the outdoors and doing a ton of hiking, summit hikes here in Washington. Obviously, we have no shortage of natural beauty and things to explore, and I was really big into that. And taking my son up, and we just had our daughter, and for me not to be able to play with him anymore, pick up my 1-year-old daughter anymore, play with my son out in the yard, go on hikes, it's devastating. It was heartbreaking, and at times I felt like I was suffering from depression, because I just could no longer do the things that I loved doing, and that helped give me purpose, right? And we all have jobs, but we are, my job doesn't define who I am. It's what I do with my family and my friends, and what I'm passionate about that does. So more than anything else, I wanted to get that part of my life back, right? So that's kind of the full backstory, or at least a very abridged version of it. But yeah, leading up to the surgery, I was more than ready. And I remember just even going into the hospital, you know, my posture was starting to suffer heavily over the past like 6 months. You know, I was already like log rolling in and out of bed. Getting in and out of my car for my work was painful for so long. I was already living with a lot of the pain and doing a lot of things that you probably have to do post surgery. So really it got to the point where I'm like, I'm already doing all this stuff, you know, I might as well go ahead and go for the surgery. So, and again, once seeing the MRI images, it was abundantly clear that this was the only recourse that I had. So, day of surgery, I got some notes here. You know, pretty smooth process getting in there, getting undressed, you know, getting ready, laying in the bed. You know, they kind of rush you into the room. It's this giant room filled with a lot of people, at least in my scenario. You know, they give you the oxygen and they're like, all right, we're going to administer the, you know, the drugs to basically the IV to knock you out. And I remember thinking, okay, all right, I'm not feeling anything yet. And then bam, that was it. That was the last thing I remember, is thinking to myself, God, I don't feel any of the drugs yet. And then I woke up in a bed, you know, with the nurse there, and groggy. I remember like sleeping a little bit. I remember my wife being in the room, you know, and I'm not going to sugarcoat anything. It was painful, at least for me. I don't know if I felt the nerve pain was gone, but obviously when they're, you know, I have two, you know, sizable incisions like this on my back, right? And then the part where the minimally invasive inch incision is, where they went in there and kind of bore out the disc, put in the spacer and the kind of the bone graft, bone putty that they use for the fusion. You know, I could feel all that. Like, it was obviously, your muscles are angry, they're tense. A lot of pain. Obviously, they do give you some drugs. Dilaudid was the best. The IV administered drug really helped me get some sleep for that first day, you know, maybe 2-3 hours at best. I'm not sure, everyone's cases can vary, but I know a couple of the nurses, and it's nothing against them, but where they would raise up the bed too quickly, excruciating pain, and I wouldn't work, you know, wish that on my worst enemy. It was awful. So it's not fun. Some people have like really good euphoric experiences. You know, I don't know if I had that, but I did feel like some of that pain was gone, and they do get you up and walking fairly soon, at least for me that night, because I was put under about 12:30, and I think I went for my first walk at around 9 o'clock that night, kind of around the little area there. Occupational therapist came in, we did a couple steps up and down. You know, she really wanted me to work without a walker, and they put a little harness around your body, and they kind of like, so they can hold you just in case you slip or something. So I did a couple walking sessions that night, which was very encouraging. I felt a little more upright immediately afterwards. But I was really shaky. I was dehydrated. So I had to stay an extra night, you know, some fluids, went home the next day. Still felt really shaky. My legs would shake horribly getting out of bed, you know, pounding fluids. And, you know, really, I think it was Monday. I remember because it was after we were watching some of the football games on Sunday. And I remember feeling like kind of turning a corner that day. I was still taking like the oxycodone and things like that. But I remember Tuesday night, I just woke up after having a couple oxycodones at 2 o'clock, trying to stay in that 3-hour regimen. Waking up again at like 4 and just feeling awful. Not my back. I mean, yes, there was pain, but it was more of a sickness from the medication. So again, this could just be my story. I know I've read and, you know, seen some videos where people have had kind of similar situations where they just did not respond well to the drugs. So my advice is listen to your body. If you are taking the drugs and don't have any negative side effects, by all means, stay at it. For me, I had to basically like detox off the drugs for a couple of days, and it was really rough. It was actually harder probably than like the post-surgery pain, as crazy as that may sound. So I've basically been on nothing but Tylenol extra strength ever since, maybe like 4 or 5 a day. And then I do one muscle relaxer at night to kind of like help me get to sleep, kind of help me reset my sleeping patterns, because that first week, your sleeping patterns are really screwed up. You're probably aren't going to sleep that well. And it can be a bit of a hard transition, especially if you were on a pretty regimented schedule to begin with, like I was with my job. So I'm still not quite there yet, but I'm feeling better, and I'll get into that. But yeah, that first 5 days post-surgery was pretty tough. And then I think by about Thursday, I kind of like turned a corner to where I was feeling hydrated again. My appetite was back. That was the first day of a bowel movement, so I know that's always kind of a fun topic, but when you're on all those pain medications, sometimes you don't feel like you're ever going to be able to relieve yourself that way again. And for me, it was kind of nerve-wracking a little bit, because you're eating still, but you're not actually like expelling anything, right? Aside from urinating, right? So that was good. The stool softeners probably helped. I didn't take any after that, though. The minute I had that first bowel movement, it was just, went back to a normal eating routine. And it seems to have been fine ever since. No issues there, which has been great. So yeah, that first week was kind of touch and go. I was walking. If you can get a walker, get one. It really helps getting in and out of bed, because those first, 4 or 5 days, at least for me, 6 days, having the walker next to my bed was a huge help, because I had to kind of log roll. It was a whole process, right? And my wife had to really help, and my dad was here, my mom was here to help for the first few days. Grabbing onto the walker, turning over, getting my like arm underneath me, and I would actually have like kind of both arms like this on the bed, and I would press up, and then kind of like as my body, I'd press up to kind of keep myself like this until I sat up on the bed. And then I kind of like wiggled my legs a little bit, and then slowly, stood up. And I still kind of do that now, but I'll kind of get into this week. And I promise there's some good news at the end of this, and I kind of want to keep this video under 20 minutes. But that first week was pretty much like that. It was tough. There was challenges. My mind still thought like, okay, was this the right thing to do at that point? I mean, you get all these things going through your mind. But that Saturday and Sunday of the following weekend, I started to turn an actual corner, like a real one this time, where I was now starting to do walking sessions, where I remember, I think it was last Saturday, which was basically a week at that point, doing a few laps around my kitchen and my living room, kind of where I'm standing now. And there were some times where I didn't feel anything. And for those of you that are watching this, probably can relate to me, or hopefully you will be able to relate to me, or you have, because you've gone through this. What an amazing feeling that was. It was brief, but to not feel any discomfort, it almost brought me to tears. But I was just smiling, ear to ear, just beaming. Didn't last long, because then soreness set in and pain set in, and but it was good. And I've been on a regular schedule like that. It's been getting longer and longer. So kind of notes from this week when things started to get good. Monday I was about 3 10-minute sessions a day, roughly. And by Tuesday, more of the same, essentially. By, I think, that weekend to about Monday or Tuesday this week, really getting in and out of bed was like easy at this point. Something you kind of look forward to in a way, where there's still some discomfort, but, it's very mild. compared to what it was. I actually breezed past this, by the way, but showering was a big thing. I should have mentioned that last week. I think it was day 5. I was able to get into a shower. My wife bought a little stool in there that I used for the first couple days just to sit down, rinse yourself off, clean yourself. I had the glue on my incisions so I could let water run down. I had a little sponge stick essentially that I could gently at least just get some soap back there and kind of let the water run down and clean it. So that was a huge help. I'll get into some items that are, I think, at least for me, were clutch. And some of them I'm still using to this very day, 2 weeks in. So, but Wednesday was a really good day. I think I had almost a 18-minute walking session. So for me, that was huge. I was out in the yard, kind of walking around up and down the driveway, up and down kind of the street a little bit, on our deck. It was a lot of movement, and that was progressed. Same with Thursday and Friday, more of the same. And, it's been really good, right? So I think for me, the first week was tough, but the second week, pain levels went down dramatically. Each night, I feel like I've gotten a little bit better rest. Some nights are kind of, there was a couple nights where I didn't feel like I got as much rest, but one of them was because I sneezed. If you can avoid sneezing at all costs, believe me, try to stop yourself from sneezing, because I woke up and it was just something I couldn't control and I just sneezed, and man, it just pain, sharp pain. I had immediately reached for my Tylenol extra strength and pop a couple to kind of ease my back down again, and then I slept for a few hours after that just fine. But sneezing, coughing, still an arch nemesis of me at this point. So but yeah, some overall things that some of you may or may not experience. For me, I still have pain, but it's in the sacrum, or the sacrum area where your tailbone is, kind of that structure right where the L5 S1 meets, below that, kind of as it runs kind of up around your glutes essentially. I did go in for my first 2-week visit. We looked at the x-rays, everything looked good. I'll post some pictures on the next video a week from now. What it looks like, but the screws are in, the bars look good, the spacer's in the right space. I still have a little bit of a twist in my lower spine from the injury that they couldn't fully correct, so it looks a little weird, the spacer's kind of turned a little bit, but thankfully, and that's one of the biggest things, is that the surgery goes well, and so far it looks like everything's in the right spot and it looks good. He said there was no visible signs of any kind of problems. He said that area, that the sacral or the sacrum area, looks good, and any of that pain you're feeling is muscle pains from being stretched, being used differently, that they haven't been used. My posture is straight now, so if you are experiencing some pains and things like that, it could be a good thing. That it means that yes, your posture's been corrected, things are in the right spot. But now your muscles have to get used to it, and you have to start to train and use them. So that gave me a lot of confidence that some of that pain I was feeling around the tailbone and just north of that and east and west of that was just the muscle pain. As far as the incision pain goes, it almost is now more of a tingle. If I press on the area where the hardware is in my back, it's still a little puffy and sore at times, but it doesn't hurt. That area of my back, there's no pain anymore, which is phenomenal. As of right now, things seem to be in a good direction. I'm feeling way better. My mood is so much better. I can, like I said, I can get up, I can shower, go to the bathroom, get myself food, go for walks. Still aren't able to really I'm not able to put on pants yet without help, so my wife has had to help me dress myself with socks and things like that, because I still don't have that flexibility just yet. And again, one thing I can impart onto anyone here watching this video, please listen to your body. I know that sounds so contrived and played out and redundant. You hear it all the times, but it is so true with something like this that is a bit traumatic, right, on your body. Listen to your body, right? If you see videos of people out there doing yard work or running or lifting weights 3 weeks in, if you don't feel that your body's there, don't do it. Like, walking is perfectly fine. Like, right? You gotta give your body some time to recover, right? So some other tips. So I've been taking like an organic multivitamin and a calcium supplement. I've been doing kind of a vegan protein shake. I'm not looking for anything. Garden of Life is the one I've been using with some almond milk. Almond milk, the calcium in there, it's a little more easily absorbed by the body than actual standard milk. And that's not, I'm not, saying anything bad about dairy milk, but, for me, if you can do almond milk, right, there's not an inflammatory response as there is with dairy, so it's a nice thing to do. You want to reduce your inflammation levels naturally as much as you can. So eating like a whole foods diet has been really nice. I've been doing literally just salads, fruits, vegetables. We got some HelloFresh meals to kind of help us get some of those healthier meal options, fish, whatever. It's tempting to do comfort food and things like that, but sugar, dairy, a lot of those things that, red meats, anything that's going to cause that inflammation in your body, I would just stress to avoid it. As hard as it may be at times, it has really helped me feel better, keep my immune system healthy. So that's kind of my eating habit. Have breakfast, hour later, have a shake, take the multivitamin, have a good big salad for lunch with some fruits, maybe some nuts, things like that, and then dinner, try to eat something very healthy and organic like that too. Now, with that being said, we did have a huge cheat meal night last night with some, we ordered a pepperoni and sausage pizza for the family, and it was absolutely amazing. So again, treat yourself when you can, but try to follow the 80-20 or 90-10 rule, whatever's easier for you, but try to have the majority of your meals be healthy. And getting things like protein shakes and extra calcium in your body will really help, because you want that bone to fuse as quickly as possible, and around the screws as well too will be really helpful. Other things, again, I already mentioned it. If you need it for assistance for showering, get the little shower stools. They are wonderful to use. They got places that you can hold, like a sponge like I was using. If you have a detachable shower head like we did, you can kind of set it in there as well too. It's been really helpful. A walker, which has been, that was absolutely clutch that first week. I think I kind of ditched it at day 8. I stopped using the walker. Grabber, I should have had it near me. It's right there. I just can't reach to grab it, but get one that's long. So for me, I'm over 6 feet, like 6.5, where you can just keep your arms straight and have the grabber touch the ground. I use that thing all the time because reaching can still be very painful. The whole BLT, right? No bending, lifting, or twisting. That helps me pick up things. You drop your phone, right? If you need to grab something, for me, when I get my own food, it helps so I can grab things out of a lower cabinet that I wouldn't be able to reach right now anyways. You name it, right? If you drop something on the ground, you need to move something, it's just been a really, really useful tool for me is to have that grabber. Another thing too that's on the bed next to me is a wedge, right? Just a soft triangle wedge like you've probably seen in gyms. I think my mom bought me that kind of as like a recovery gift at Costco. Just plain, nothing special about it, but having that on the bed and then having your knees and then your legs sit down a plane like this, and then having your back kind of flat with your head propped up a little bit on, I use a couple pillows. And that's pretty much my resting that I do numerous times a day, is just kind of be in that cradle position. And it is one of the best positions you can be in to take pressure off your lower back. It also helps with that circulation and helps obviously speed up the recovery process, and even with healing where the incisions are. So, huge relief there that you can do. So those are just a couple little things to have around the house that I would strongly recommend. If you can get some more of those little gripper socks, we ordered a bunch of those. They're not stylish, they're not cool, but it does give you that extra confidence when you're walking around on hardwood floors, that you got a little extra grip in your step, and that you don't have to worry about falling, right? So that's pretty much my first 2 weeks. So excitement for the surgery, a lot of pain, detoxing from drugs, doubts that I was going to get better, felt like I was having setbacks with some of that lower pain in my sacrum area. Turned out it was just muscle pain, which gave me a huge list of confidence. And then really like especially the last 5 days, I would say, days 9, 10, 11, 12, 13, 14, maybe 6 days, have been so much better. But this has probably been the best day, day 14 so far. And I'm really looking forward to posting another video a week from now, and then another video at the one month mark, and kind of tracking my progress. Again, I'm not doing this for likes or shares or monetary. This is strictly to help anybody and to help me document this journey myself, because it is a life-changing thing. But the good news is, if you were like me and you were suffering from this debilitating pain that was just taking away from your life, the road to recovery is a great one. And I'm looking forward to hopefully being stronger and better than I was even this past 5 years, when I thought I was doing all right, and actually getting back to the things that I enjoy doing again. So again, if I can impart anything on this first video for the first 2 weeks, rest a ton, walk when you can, even if it's with a walker. Just get up, get that blood flowing. Sitting for me isn't bad, so I'm sitting right now, but I've positioned a chair with a couple blankets behind it, so it kind of keeps me very upright and it's soft. And I switch positions, but stay as active as you can. But again, listen to your body. So if you start to get sore, like when I do when I'm doing my laps, sometimes I only walk for like 8 minutes, because then that lower muscle area starts to get sore. I stop. There's no reason to push it. Heating packs are great when you need to loosen the muscles up. Use ice when you can to help, relax the muscles, especially around the incision area. And then eat very healthy. Take some supplements if you can. You don't have to if your diet's really strong. My diet, I feel like, is really strong right now, but I'm still taking supplements on top of that, because I just don't want to take any I want to take any additional risks. Like, I want to make sure that I'm doing this right the first time. I don't want to have any regrets about, I wish I would have done more of this or more of that. Like, I'm definitely doing everything I can. Stay away from, temper your expectations. Again, if you see things of people doing crazy stuff within 2 to 3 weeks, don't use them as a gauge, right? Use yourself as a gauge. Again, this is coming from someone who was extremely physically active my entire life. Listen to your body, take it one step at a time. There is no need to rush in this kind of, with this kind of a process, right? So rest, walk when you can, eat healthy, stay positive. And if anything I said in this video helps you, it'll help me too, right? So, again, like the video, leave some comments, share. You can ring the bell for additional videos. And I will start answering questions. So, I hit on a lot, but there's probably a lot of little things that I didn't talk about. So if you are curious or nervous or scared or just want to ask anything, please. Now that I've been through it and it's fresh in my mind, I am excited and happy to help anybody with any type of questions, right? So, because if I can be a help to somebody else, like a lot of people that I've reached out to that have helped me, kind of pass that along. I think that's part of the recovery is being, someone that who receives that help and then helps pass it on to other people, right? And then maybe you can do the same then in your journey as well too. So anyways, look forward to posting another video in a week. It's been real. It's been challenging. It's been fun. But as of right now, I can tell you, the first 2 weeks, now that they're done, I'm feeling much more confident and better than ever. So, all right, YouTube, I'll check in with you in a week. Bye.